Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today's episode is part 3 of a special 3-part series focused on polymyalgia rheumatica, or PMR for short. Over the course of these episodes, we learned about PMR from Dr. Grace Wright and patient advocate Linda Rinaldi. Now today, we're joined by JP Summers, patient advocate and community outreach manager on our advocacy team with GHLF. And we'll be talking with JP about advocating for yourself in everyday life at the doctor and with stakeholders when it comes to living with PMR.
But before we listen to your interview with JP, we should note that this is our last episode of the year.
That's true. That's a wrap on 2023 season.
That is a wrap. Before we depart for the year, Zoe, what are your highlights from the year?
That's a good question.
In podcasting world, I mean.
In podcasting, well, I got to join Connor and Robert on Healthcare Matters, which was a really fun experience. But in terms of our podcast, the one interview that really stands out to me was the one that we did with Julie Bach. She talked about being an office manager and how she advocates one patient at a time, arm in arm, saying, let's do this together, and just the amount of people it takes to help patients get good care. Julie's patients are so lucky to have her, and it left me feeling like everyone needs a Julie.
Yeah, absolutely. That's a good one.
How about you? What are some highlights?
Well, my biggest highlight of the year in terms of advocacy was getting back to some of the states. I had the good fortune of being able to visit some state capitals with some of our fantastic patient advocates, and just to be out there again with our patients felt really good, and it had been too long, so that was good stuff.
For sure. I remember after our team was on the West Coast, they had mentioned that it was the first time a legislator had heard directly from a patient about their story and the impact that made. So that was definitely a highlight, just hearing about that and thinking about how many others haven't heard from patients and the work we could do in 2024 to make that happen.
Yeah, I just want to take a moment to express how grateful we are, and a big thank you to our 50 state network advocates across the country. We are so humbled to do what we do and to work with such dedicated, hardworking patients such as yourselves. So thank you.
Definitely. I second that. It's exhausting living with a chronic illness, and it can be exhausting, like what feels like fighting the same advocacy battle year after year. But each year we see a little bit of incremental change around the states and more momentum federally. So thank you to all of you who put yourselves out there with our network and share your story.
So with that, let's go to the interview with JP.
JP, we're so happy to have you here today. Welcome to the Health Advocates. How are you doing?
I'm doing really good, Zoe. Thank you for having me on here.
Of course. Thank you for joining. Why don't you start off by introducing yourself to our listeners?
My name is JP Summers. I am a patient and a caregiver, and my role at GHLF is patient outreach manager, and I focus on patient advocacy.
And part of that role, you did a lot of outreach over the past couple of months with PMR patients. Can you talk to me about some of the main themes that came up in doing this outreach and chatting with patients?
Sure. So during these conversations, I found that pretty much everyone I spoke with took immediate action. That you don't hear too often. The second they started to notice a change in their normal, when I say normal, like they were noticing symptoms, especially in their shoulders, they knew that they needed to do something about it. And so they took the initiative to check into what could be causing it. And that to me was such a great way to see how people really do pay attention to what's going on with their bodies. And another thing was that once they received the diagnosis, shortly after seeking help, they immediately sprung into action. They did whatever was needed to be done. And as a patient, I just love how, again, they were just so mindful of themselves and what wasn't normal for them. And I just found these conversations to be very insightful. I learned a lot from them.
That's great to hear. When you say take action, you mean like go to the doctor's office and say, hey, something's wrong? Is that what you're talking about?
Yes. So they would either call their primary care physician. There was a few that actually actually went into urgent care because, again, all of a sudden they found themselves debilitated to the point where they're like, okay, something isn't right. Did I hurt myself? They took notice of those debilitating symptoms. And so they sought out either a primary care physician. And even from that point, they sought out a referral to see what's going on with their bodies.
And in learning about those stories, did you learn any like important questions or symptoms that patients brought up with their doctors about PMR?
Definitely. I did learn that for most of the people I spoke with, they were very active, whether they did exercising or they had a full-time job. And their concern was, I can't do my normal daily activities. And for them to note those differences already, they had those questions already to ask whenever they were seeking, again, consultation. And again, that's important to note these changes down and then ask them whenever you go to your appointment, because as someone who deals with symptoms almost on a daily basis, I know that when something isn't right, you always make sure to bring that up during an appointment, because again, the best way to get answers is to be very proactive and seek out what it could possibly be wrong with you. And so that was something that a lot of them actually said, that they walked in to their appointments, or again, when they went to urgent care, they listed everything that they could not do on a daily basis.
And in thinking about those things of what you can't do and all of a sudden things that you're used to doing is, I guess, taken away from you because now from the pain and symptoms, you're not capable of doing that. It can definitely cause, I guess, some like stigma with those around you and you're not acting like you used to. And people can think, why are you being lazy? JP, do you have advice on how to advocate for yourself amongst family and friends or explain to them like how symptoms are impacting your daily life?
Yes. So when you are looking at a possible diagnosis, or if you were diagnosed with something, it's so important to educate the ones around you, whether it's coworkers, family, or friends. Just speaking openly about what you're going through can be very helpful, not only to let them know what's going on, but also mentally. It could be something that helps you to accept what's happening in your life. And again, you need support. So by speaking openly with the people in your lives, that helps you to find that support, or who could possibly be there while you're going to these appointments. Or you could just vent to when you're frustrated, when a treatment isn't going right, or you're just having a bad day. So definitely, raising awareness is an important part of, I call it a part of your treatment, because you have the different things you do. You seek consultation from a medical provider, then you go on to your treatment, whatever that may be. But then another component is having that support of the ones around you.
Yeah, I love that you called it part of your treatment. It's so true. Like, there's no shame in asking for help, especially if help is going to get you to a place of feeling good. And if you need someone to lend you some spoons because you're out of them, that's totally okay. Can you maybe share some advice on how you ask for help if people are feeling really stuck or embarrassed? I know PMR can often come on later in life, and this may be a group of people that like haven't asked for help before. So what's your advice for just even getting started with how to bring up that conversation?
So yes, the conversations can be very challenging to have, mainly because you may feel that people are going to think that you're either seeking out attention, or that the situation that you're currently in may not be as important, because again, everyone sees themselves as, they don't want to be a burden. So the best way to lessen or ease your mind is to start a conversation. Just explain, this is what's been going on with me. I have concerns, and I just wanted to share this with you because you're an important person in my life. You play an important role, and I hope that you can be there, whether it be maybe helping get me to appointments or just being there to listen. But I really do need support right now. And this would be, again, a way for them to open that conversation, because you don't know what's going to happen. And that's the scary part. You have no idea what the next steps are going to be, especially if you're newly diagnosed. So just opening up your mind to having those conversations with people in your life can make the transition into this diagnosis so much easier. And again, I know a lot of people tend to not want to feel like a burden, but at the same time, when you're having those conversations, it does make it a little bit easier to deal with what you could be going through in the future. And I feel that the more conversations you have with the people in your lives, it can lead to even a better outcome, because people don't realize mental health is a form of self-care. And even if you're having a bad day, if your symptoms are so debilitating, if PMR has you having these symptoms that keep you from, again, doing exercises, keep you from going to family events, then these people are going to understand, because you had that conversation with them, that you were comfortable enough, that you expressed your concerns early on, so that, again, if down the line you need to seek out some kind of, just having someone there can definitely help with the process of going through this diagnosis, this new life, because it is a new life that you're leading, and it's just how to navigate through that. And these people, again, around you play an important role. Even though they may not realize it, let them know. And it's hard to bring up conversations sometimes, but if you ease into it, I feel that more people will understand, and then you're raising awareness. You're getting them involved, because I know personally, there's so many people I talk to, I learn from them. And again, being chronically ill, you go through different challenges. And I feel that a lot of people didn't even know certain things could happen in your life. And once you have those conversations, once you open that door, it does make a huge difference on the relationship between you and them. It can actually strengthen it. A lot of people feel like, I don't want to bring it up, but at the same time, I've had my relationship strengthened because I stopped worrying about what people were going to think. And I had those conversations, and it has been the best thing for me physically and mentally.
I really relate to that piece you just said about, people may not even know. As you know, I live with chronic illness also. And in the beginning of my journey, I used to get really frustrated when people wouldn't check in on me. And I slowly learned that I could just say, hey guys, I'm struggling today, or this is what's going on. And they were then much more likely to ask questions or reach out. And it made me realize it's a two-way street, and people can't read my mind and know what's going on. And it's really important to bring up my symptoms, what's going on, because physically from the outside, people may not know that I'm living with these conditions or having a hard day. So while it takes a lot of courage to bring it up, it definitely, like you're saying, is worth it in the end.
Yes. And I love that two-way street, because it truly is. People may not realize you're struggling, and they may not check on you as often as you think maybe they should. But at the same time, even you reaching out to them, telling them, I'm having a difficult moment, I'm having a difficult day, that can truly, again, strengthen that bond. And again, help them understand that you may be okay for a few days, but then there's those tough days where you really need that support. And just even telling them through text or a call to say, I just need to have someone there for me. That makes a huge difference. It really does. And it took me a long time to realize that sometimes I just need to say, hey, I just need to have someone listen to me. I had a really terrible doctor's appointment. I got answers, but it wasn't ones I wanted. And I just need someone that's there that could just listen to me. And I love that it is a two-way street. And sometimes you do have to be the one to make the initiative, but it does pay off when you do, because I feel like that, again, helps them understand your struggles, what it's like to be a patient, what it's like to have that diagnosis.
Definitely. And actually, what you just said about you just wanted to vent about the doctor's appointment, that kind of made me think sometimes it's even helpful when you're asking friends, family, your provider for help to say, right now, I just want to vent. So can you listen? Or I could really use physical help where you can go run an errand for me, or saying I actually really need your advice on what I should ask my doctor, or I need accommodations at work. How did you go about doing that? And sometimes even just framing what kind of support and response you want from someone in that moment can be really helpful.
I agree with that, because definitely, having someone there to help you through this, like running errands, some people don't realize how hard it can be when you're in a flare up. as you learn how to do your daily task when you're in a flare up, it's one of those things where if someone was to offer, like just to go to the pharmacy for you or drop something off, it makes a huge difference. And it also helps you to feel a little bit better about what you're struggling with. And I know how important it is to have that little bit of extra help. But when I say little bit, I mean something as small is huge for someone who is chronically ill, and someone with PMR, when they have those debilitating flare ups, it can make a huge difference on how you can go about your day. And again, just how to make it out of bed to just do the simplest tasks like brushing your teeth, taking a shower, just making a cup of coffee can be a challenge. I know, like, I have friends that drop coffee by for me. They'll just say, "Hey, I know that you were having a bad morning." Because again, reaching out, I sent a text saying, "God, I'm not feeling the greatest." And then they'll be like, "Do you need anything?" And I was like, "Well,
Oh, you're such sweet friends.
I could use, something, or, "Hey, could you maybe pick this up for me? I was going to go out to the store." But again, saving spoons, saving my energy, because I know that I have a long day ahead of me, especially when you wake up in the morning, you're like, okay, how am I going to make it through this day? So yes, I agree with a lot of what you're saying. I really do.
So, switching gears a little bit, we talked a lot about advocating for yourself with like family, friends, a doctor, but there's also larger scale advocacy work that we do, that you do, about like engaging with legislators, stakeholders, policy. Can you tell us about how you work with our 50 state network advocates, and you do a lot of the outreach calls and learn about their story? And maybe it would just be helpful to learn from your perspective, like how you talk to patients about getting started on their advocacy journey.
Sure. So I would say the number one thing I do when I make these calls is I listen. I listen to what they have to say. What did they go through? What are they going through? And from there, then I know what direction to go. Because a lot of times, some people are comfortable with being in front of a group of people. Some people would rather do virtual advocacy. Some people would love to write down their story, and which could be given as a written testimonial. But the main thing is, everyone has a reason why they wanted to be a part of the 50 state network. 50% I would say is out of frustration. I know that's why I signed up originally, because you're frustrated with the outcome, whether it be the insurance company or that you're getting nowhere with your treatments or you keep having issues with your health. And when someone shares that information, again, that helps us to know how to guide them into which direction maybe they could help us with in the 50 state network with advocacy. And I know doing in-person advocacy for me personally has been so life affirming. It has made a huge difference because I can't get back the time that I lost from the time I was early diagnosed with my chronic conditions, but being able to talk about it with legislatures, being able to share what happened to me, my experiences, has made a huge impact on me on a mental level. And emotionally, I feel like I've gotten little pieces of my life back that makes me feel good about the fact that I was able to make it this far in life, despite what my chronic condition has done to me as far as debilitating wise with the symptoms. But I know that when these people sign up for the 50 State Network, they have something to say. They want to share their experiences. And a lot of them mainly do it because they want to help make a difference. They want people to know what they've gone through. And that is so important, because when you paint the story of just the simplest things that you try to do on a daily basis, and if you need to get access to medication and you're having all these unnecessary obstacles, these people that want to take action are very passionate and they want to raise awareness. And again, that goes back to what we're talking about when you're speaking to family and friends, coworkers. That's a form of advocacy. And right there, that's a way to raise awareness. And that actually is practice to doing in-person advocacy, or again, virtual advocacy, because the more you talk about your condition, I feel like it's healing. I know for me personally, it can be hard at times to discuss what's happened in the past, but at the same time, I feel a little bit, I've healed myself, that it's like, you know what? I found a way to get back the times, that the moments that I lost with my kids, the events I couldn't go to, the time where I lost access to my medication. And advocacy has made me look at life in a positive way. And I say that because when someone goes through all these life changes, it can definitely make you think about, how am I even going to make it day to day? And advocacy truly is something that I know can help others to continue to fight, to continue to look at this new way of life. And for most people, if they're able to share their story and raise awareness, that is something that they really want to do. And again, speaking to your family and friends is a way to get started. And then just all these things that come up that we can have these patient advocates get involved with, it's a way for them to feel like they have some control. That's one way that you can regain that control of your life.
Yeah, that's really beautiful, JP. I love like you're saying that you're healing yourself while you're sharing your story. And just to bring it back to PMR really quickly, is that I noticed in a lot of my outreach with patients that when they were diagnosed with PMR, they had no idea what it was. And when they were Googling, there wasn't a lot of information out there. And they said they like maybe had heard of one other person that had it. And I think what you're saying resonates probably even deeper with the PMR community in the sense that it's so important to share your story, because despite PMR being a popular disease and a common diagnosis, for some reason there just like isn't a really loud vocal community around it. And we're here today to talk about it, to try and change that. And I think like it's so important that even if one person feels less alone, this is what Linda said in the interview with her, like we've at least helped that one person. And it's important to think about all these different conditions and how we can continue to raise voices.
Yes, and I completely agree with that, because it can be a huge challenge to have the day-to-day when you're chronically ill. But when speaking to the patients with PMR, even a few caregivers that I spoke with, there was another common thing I heard is that it was frustrating. It was frustrating because, again, all of a sudden they couldn't do something they were used to doing and they wanted answers. And when they got those answers, a lot of them were very discouraged or upset, and they didn't realize it, but they were starting their own advocacy by pushing for answers. And when I spoke with a lot of the people, I said, you definitely advocated for yourself when you walked into that doctor's office, when you went into urgent care, when you got an answer that maybe wasn't what you wanted to hear, you were already advocating. And I think a lot of them were just kind of shocked because they didn't realize that was a form of advocacy. And to hear them, even though they were going through that situation with the symptoms, talking about how their lives have already changed in the early stages, a lot of them were optimistic about, I'm going to start this new treatment. I hope I see good results. So just hearing that positivity already in their voices, that made me happy, because I love when another patient or caregiver I speak with has something positive to say about a situation they had no control over.
I think that's a beautiful note to end on. There's no act of advocacy too small. Just by walking into that doctor's office, you're advocating for yourself. Like JP mentioned, talking with your family and friends, advocating for yourself. Even just doing simple tasks for yourself is a form of advocacy. And if you want to join our 50-state network and get on a larger scale in front of legislators and stakeholders, we're here to support you in that journey as well. But just the message that there's a lot of ways to advocate, and we're here supporting you. Thanks so much, JP, for joining us today.
Yes, thank you for having me, Zoe.
Wow, that was a really great interview with JP. It was fascinating to hear her talk about her work and gaining community support and leaning on friends. And I think that there's some useful information there for our larger community.
Yeah, definitely. I learned so much from JP about advocating for yourself, whether it's living with PMR or another chronic illness, and just leaning on those around you.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, definitely email us at podcast@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating and write a review on Apple Podcasts, and hit that subscribe button wherever you listen. It'll help more people like you find us. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you in 2024.
Next year.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.